Hi, I'm Jim Arciero, State Representative for the towns of Chelmsford, Littleton, and Westford. And thank you for tuning in to my From the Hill Zoom version of my show. I've been recording every week to get perspective from folks that are in the field in this region, going through the COVID pandemic that myself and so many families and first responders are dealing with throughout this district. And what I wanted to start with was having a conversation with the chiefs of fire and police in the three towns that I represent. And today we're starting with Littleton. And I have two of my good friends here, Chief Matt Pinard from the Littleton Police Department and Chief Scott Wadzinski from the Littleton Fire Department. Guys, how are you?
Hey, Jim.
How are you?
Good to see you. We've been working a lot with one another, I would say, over the last 6 weeks or so, when this pandemic really started to ramp up with the Life Care Center in Neshoba Valley and Littleton. But before we talk a little bit about that, gentlemen, I wanted to sort of get your perspective on how it's been out in the field, the work that you guys do each and every day. You know, your communities rely on you to make sure that people are safe, that people get to the hospital, that situations are maintained in order. And I wanted just to start with both of you gentlemen. What are you seeing out there? How has things for you changed in the last 5 weeks as it is for everybody else?
I'll let you lead off if you want, Scotty, because I want to talk about. If I'm going to talk about traffic, people are adhering to the stay-at-home order the best they can. You know, traffic has definitely dimmed down quite a bit. As far as enforcement-wise, you know, we're not doing very proactive enforcement. Just very egregious violations at this point in time.
As far as on the fire side, the biggest change that we've had across the boards is just making sure that everybody is wearing their PPE, full decon of not only our station, but our ambulances, fire trucks, helping the PD, helping with some decon in the dispatch center. And that's on a daily basis. The biggest change is that since this whole pandemic began, we now are wearing and will put we're wearing our own PPE in addition to putting PPE on the patients, no matter what their condition is, just for everybody's protection.
Now, you know, initially when the stay at home order had started by Governor Baker, and certainly as we, you know, we're coming down from the surge right now. The surge was estimated for us to be, you know, around April 10th through the 20th. Now we're at May 1st. Things are flattening. We're now put into effect on the state level contact tracing program in order to, you know, not only identify the virus, but to contain the virus after we've done testing. So those three major pieces that we've been focusing on, and I think New York is too. If you've had a chance to watch Governor Cuomo's press conferences along with Governor Baker's, to me, they're must watching and listening. One of the things that I've been seeing, you know, a lot of things I've been reading about, you know, recently, was that people in my district and in the region seem to be pretty well set with PPEs on as first responders. Is that true, guys?
Yeah, on the police side, we've been fortunate enough to have a plethora of PPE for us. And you know, thanks to Scott and being the MEMA director, that we actually have it such at hand. It's fantastic.
Now, how many, just for everybody at home, how many members are in your department, Matt?
So we have 19 full-time police, 7 full-time dispatch. You know, my dispatch center, as you and I had talked about briefly, there's only 7 full-time dispatchers in the dispatch center itself. Early on, we got hit pretty bad when there was 3 dispatchers that actually tested COVID positive. So we went down to 4 dispatchers, and we had 1 part-timer that really stepped up, filled the void for us. But as you know, and as we've had these conversations prior to this, very detrimental for these small towns. as we provide communications for not just police but fire, Littleton Electric and Water Department, Highway Department. We're the lifeline, the hub of the town, right here at 500 Great Road. So that was tough. It was very, very tolling on the dispatchers that were in there at that point in time. And, very fortunate that we shut it down and isolated the dispatch center right away. Chief Wazinski was sending over 2 guys every morning to decon the entire communication center. And everybody was given a written order that they'll wipe down, with Lysol and alcohol wipes. And if they felt necessary to wear a mask when they're in the station, then they'll wear a mask. Again, very fortunate that 19 sworn police, not a single one was sick. Not a single one was and I knock on wood when I say that, Jim, but right now, we've been very blessed that no one has contracted COVID in the patrol side.
Now, have you noticed, when folks, there's been some resistance to the stay-at-home orders. We understand. It's inconvenient. It's detrimental to your financial standing. It's a scary place to be when it comes to a small business owner, or anyone right now who isn't able to work regularly to take care of their family. It's a scary thing. But the alternative is what? The alternative is death.
Yeah. So
we do have decisions. We can make decisions, and you guys see that. So my question, I guess first to Matt is: have you seen, since people have been home, we're not sheltering in place, but we're a stay-home order. Have you seen more domestic issues? Have those ramped up at all on your side, Matt?
So it's actually that's a good question. The domestic, nothing. The call volume kind of just dropped out of sight at first, but now you're starting to see I think that everybody's kind of getting that I guess you could say cabin fever a little bit, and I think you're starting to see a little increase in it now here at the PD. It just goes without saying that that's what's going to happen, and hopefully that in the next, May 18th, I believe the Governor Baker is looking to start opening some things up. Hopefully that the cabin fever doesn't ramp up so bad that we have anything worse than we've had so far. We'll see. We'll take it day by day.
Now, Scott, have you found that the calls have increased since the stay-at-home order, or during the pandemic? I mean, certainly we know they increased quite a bit to the Life Care Center of Neshoba Valley, but overall, in the aggregate, did you see an increase?
We had that initial spike with Life Care, and once that evened off, things actually quieted down for a little while, but they're pretty much back to normal right now. Our run volume is comparably about the same as it was prior to the pandemic, but it's different. It's a little bit. One of the things that we're finding is people are actually afraid to go to the hospital for general illnesses, and they're becoming sicker. And so they're waiting because they don't want to be exposed to any of the COVID stuff at the hospitals. So now when we get called for a medical, it's actually it's a serious medical in many cases, and just because people are waiting too long.
Now, Chief, have you felt that that sort of fear of going to the hospital? I mean, part of it, certainly is the fear of contracting COVID, right? But the second piece of it also is there's a lot of different messages that we've heard in the last 6 weeks. Things have changed, information has changed so quickly that there was initially some messaging that was out there to say, try to do things through your primary care physician. Make sure you have the symptoms. Try to go to the hospital at the last resort. But I had Christine Schuster, that I know both the chiefs here know very well, and she was on the show last week, with the same message that Chief Wazinski and Chief Bernard have, and that is, if you're sick or you're hurt, go to the hospital.
Definitely.
I'd have to admit, it it's a very uncertain and unsettling time that it takes a little bit of understanding of the situation and how things have changed to actually go through and go to the hospital.
Yeah, it really does. There's so much fear and fear of the unknown. You know, there's people that are asymptomatic and you don't know. You know, it really boils down to take care of yourself. You know, if you need medical attention, reach out to your primary care physician as your you know, first line of defense. And if it needs to progress from there, you know, go to the hospital or call 911. But while you're doing that, you know, wear your face mask. Even if you're going to the hospital, you wear your face mask. So, some of those simple things, you know, continue to wash your hands, use your disinfectant, things like that. That's something that's not going to go away. You know, as we go right through the summer and probably into the fall, that's going to be the new normal.
Yeah.
Yeah. I agree.
I mean, I also, you know, I've been on these conference calls with Mary Lou Sutters. She, you know, is Commander Sutters now. We're in the command center tackling the COVID-19. And anytime anyone asks me, or interviews that I've seen with other governors across the country or the president of the United States, when they ask the question, when will this be normal again? When will things go back to normal again? The things I hear, this is the new normal. This is the neo-normal. Things will change, of course. We'll adapt. We'll overcome. We're very resilient. But we can't say that there's an actual vaccine until 12 to 18 months. And that's the only time we can actually say, yeah, maybe we're out of the woods, but right now we're going to have to deal, right?
Yeah, there won't be a normal that we're used to, you know, back to shaking hands and hugs and stuff like that until after, you know, you've probably had a good year's worth of a vaccine out there.
Yeah.
You know,
I'll tell you, that's one of the biggest things I've noticed is you go to a meeting, someone comes at you and you're like, you know, it's instinct. You reach out to shake their hand and you're actually putting, oh, hold on. I'll give you a friend.
I know. It's true. You know, it's funny too. It's like even people that I would see with the State House, you know, I'm one of these guys, the State House, they always have the, you know, the Perel or whatever, the sanitizer that next to every elevator at the State House. I'm always using it all the time. I'm always paranoid. I always get the flu every winter. You know, I'm one of those guys. And, you know, in our positions, you as a chief and me as a state representative, we are interacting with the public all the time. It's a big part of what we do. But I'm going to have a lot of second thoughts about some of the handshakes or the extension of my hand to shake people. Or that's just going to be, you know, when you know, when we get older, we're going to be having conversations about this time, right? And what we did during that time, just like our grandparents did about the Depression, in major events in the world's history. It's crazy. It certainly is something that we're going to get through, but it really is something that we're not used to. Now, that brings me to, I wanted to compliment both the chiefs of Littleton, the partnerships, the strong partnership that we've had over the years, and in particular in a crisis. So let's recount a little bit about what happened at the Life Care Center in Neshoba Valley and where things are today, because, you know, I want to say this on record, if it wasn't, you know, for Chief Pinard, Chief Wazinski, you guys are on the front lines. You guys provided myself, Congresswoman Trahan, Senator Jamie Eldridge with the information for us to go to bat for you guys and go to bat to really try to change the path that a lot of these nursing homes are going down during COVID. And just to report right now, before we talk a little bit about what you guys saw there and lessons learned, I really think by a lot of the advocacy that we had to make things a little bit different of the way they were running things, to provide more transparency, to provide more oversight, to provide universal testing. The governor now has invested $130 million into making sure that everyone at these nursing homes, and I say nursing homes, you know, living centers, there's kind of a broader definition, that those individuals, there's accountability, that if there's money into staff that's going to be there during a crisis for oversight, there's accountability that everyone, including the folks that are employed there are tested, and that we protect our loved ones that are spending time there. But I thank both of you guys, both chiefs, really, in terms of Massachusetts. This was the biggest case, I think, in Massachusetts, the biggest example of where our government needs to provide oversight to make sure that our loved ones are safe.
It was definitely a team approach. If it wasn't for everybody working together, it really showed us that the assistance with you guys into DPH, the National Guard, everybody, fire, police, even our town administration, and everybody came together, and we were all simultaneously having some kind of interaction with this entire process to actually, pull everything together and, to make it function.
And then, just to put in perspective for everyone, watching on social media or on local cable access, what had happened was there were, and Scott, you can help me through this a little bit. I got a phone call from you folks on a Saturday morning early, looking for some guidance to put our heads together to figure out how we can get our arms around what was going on at Life Care Center. Now, this was, I want to say it was right when the stay-home order had been ordered. Was that around that time, Scott, I think?
Yeah, I think he declared a state of emergency on the 13th, and then the stay-at-home order, did it start that Thursday or Friday, the 27th?
A few days right after that.
Yeah.
That you folks had, I believe it was something, it ended up being something like 23 visits in a week.
Yeah. We on the Friday the 27th, we had started our multiple back-to-back calls up to that facility, and it kind of ramped up as we went through the weekend. Responding to the facility for so many flu-like patients. And we got to a point where we were concerned that we were going to overwhelm the medical facilities. So we, requested that initial conference call and some assistance, and tried to get the Guard in there to do some testing.
And that was where our pitfalls were. At first, we got the Guard to arrive. It was the mobile. It was probably one of the first visits by the National Guard's mobile testing unit. Was Littleton, and we had some problems with communication, I think, with the Life Care Center of making sure that everybody was tested, and there, to the defense of some of management there, which I certainly still have my own reservations, but to the defense of some of them there, this virus has changed. The information on how to deal with the virus has changed so many times, but it was definitely a difficult situation. And right around this time, Chief Bernard, I think a couple of your dispatchers were COVID.
You're absolutely correct, and they, one went out, then two went out, then three went out, and it was trying times there in the dispatch center, and we were trying to scramble, to figure out exactly what we're going to do in case, what do you do if you lose all seven? Do we just shift all of our communications over to the town of Air and pray for the best? Do we try to get some 911 operators from the state to come in? It's unprecedented times, and we plan for losing some staff, but you never plan for a devastation of all your staff. We were planning on the fly.
And and certainly early on we only heard that individuals that were posing symptoms were individuals that could be contracting COVID-19, and now then the last 3 weeks we've learned that you may not show any symptoms at all, and that's a scary thing, and something that we have to continue to adapt to. Now you've had to scrub your office in the Littleton police station, I assume, as well, and you've had to find help to fill in for dispatch, right?
Yeah, we've had some help filling in with dispatch. We've had outside cleaners come in, trauma 24 services, coming through the whole station, as well as our cleaning services. Again, the fire department comes in every single day still, and we're still disinfecting the dispatch center and control center there. And the guys, one of the biggest changes that we actually implemented was, everybody comes through one door in the back. They're all taking their temperature, and they have a checkoff sheet to see if they have any symptoms whatsoever. And, they disinfect their hands, and then they start their day. One officer in the locker room at a time, so we're not, congregating in the locker rooms. As far as roll call, we're doing it in our big EOC. Everybody's basically 10, 15 feet apart, and we do our roll call in there at this point.
And Chief Wazinski, too, you had to do something similar as well, right? Constantly scrubbing down, making sure things are sanitized, et cetera, right?
Yeah, we have the same procedures. You come in as soon as you're in the building, take your temperature, same log sheets. Everybody going in and out takes their temperature. When we go to calls, the guys, everybody wears a level of PPE. The ones that have direct patient contact are in a full Tyvek suit with a mask, boots, gloves, facial protection. And they'll come back, they'll decon, they'll put their clothes, wash their clothes, shower, put a whole new uniform on, and start over. Just everybody, for just about every medical will go through that, that process if they have direct patient contact.
Now, New York and in Massachusetts, Governor Cuomo yesterday at a press conference, Governor Baker at press conferences talking about, we've now extended things in Massachusetts to the 18th, very similar in New York as well. How do we transition back to normalcy or the neo-normal? We're probably most likely going to see construction jobs, other jobs that are lower risk start to, as they would say, kind of open the valve a little bit to let those positions and those jobs start. And then we're going to have to set up some sort of a, it's going to be from the governor's office. It's going to be a board, if you will, to make decisions on working with businesses to see when's the appropriate time for them to open. But it's going to be phases. We're going to have to make sure that we have appropriate PPEs for our hospitals, at least a month's worth, about 30 days worth, before we can open businesses. We're going to have to make sure that there's a certain amount of ventilators too, and that the stockpile of those ventilators are up to date and they're usable for hospitals. Right now, we've done what we're supposed to do in Massachusetts. We've opened 3 field hospitals, and half of the hospitals in Massachusetts, the beds are open. So we do have capacity. But as you guys know, in a pandemic, things could change so quickly if we just open and go to our regular lives on May 18th, which we know won't happen. But there's a reason that we have things in place in stages, in phases, to make sure that we don't end up back or even worse than we were before.
Right.
Now,
I tell you, Governor Baker and his team have done an incredible job, not only keeping us all informed, but going to bat for every single one of us to get what we need to do our jobs. I mean, he is really, him and his team have done an exceptional job. And believe me, has not gone unnoticed by us.
I'll echo that. That Governor Baker's team has been fantastic to work with, and I noticed that I got that phone call when you called. You guys both called me that morning, and you needed your guys to get tested. It was a scary time. We were dealing with Healthcare Center in Neshoba Valley. You had 2 dispatchers out already. Chief Pinard, and now that we know about the virus, whether you're symptomatic or asymptomatic, we need to get those guys tested so you guys can do your job. And you know what, the Secretary of Public Safety gave you a phone call that morning and made sure your guys were taken care of.
Yeah, he was fantastic.
Well, guys, I really appreciate the update. I appreciate your work. It's been a wonderful partnership with Congresswoman Trahan and State Senator Eldridge and the Littleton Board of Selectmen and the Littleton Town Administrator. we set up our own command center at the fire station for a while, and I'm sure that's still operational anytime we're going to need it. But it was a great team effort that we continue to have, and I really thank you guys for coming on today.
Yeah. Hey, anytime. Thank you.
Thanks a lot, Jim. We appreciate your support.
Thank you. Well, here we have it. I appreciate the interview we had with Chief Wazinski and Chief Pinard, both from the Littleton Fire and Littleton Police Force here in my district in the town of Littleton. I appreciate your help, your work, your advocacy, and I continue to have this conversation with my constituents and with you gentlemen moving forward. So until then, thank you, and I'll see you next time.